Welcome to Indian Anatomist. FMGE, NEET, Next 2024, PG exclusive test series. Today's question from Head and Neck region. A 45-year-old guy sustained serious injuries to skull base in a high-speed motorbike collision and was taken to the emergency department. He was advised to go to radiology for additional examination. An occipital condylavulsion fracture and an obliquely extending fracture line through the clivus were revealed by the CT image. After clinical examination, it was determined by the duty neurologist that the patient had Villaret syndrome. Which of the cranial nerves do you think might be affected by this? And the options are A. Third and fourth cranial nerves, B. Fifth, sixth, and seventh cranial nerves, C. Sixth, seventh, and eighth cranial nerves, and D is ninth, 10th, 11th, and 12th cranial nerves. Now, what is Villaret syndrome? This syndrome was first described by Maurice Villaret, a French neurologist. Villaret syndrome is a group of symptoms caused by damage to the lower four cranial nerves, that is, 9th, 10th, 11th, 12th cranial nerves, and sympathetic chain in the neck. Caused by ipsilateral lesion of the 9th to 12th, and sometimes 7th cranial nerves, and sympathetic fibers in the neck. This syndrome starts in the space behind the parotid gland, that is, retroparotid space, or parapharyngeal space. What is retroparotid space? The boundaries of retroparotid space are anteriorly by the parotid gland and masticatory space, posteriorly by carotid space and cervical vertebrae, here it is indicated by arrow, medially bounded by parapharyngeal space and pharynx, laterally related to skin and sternocleidomastoid muscle, and superiorly it is limited by the skull base, near the jugular foramen. What is the etiology of Villaret syndrome? It is also called as lower cranial nerve palsy, with Horner's syndrome. The etiology is parotid tumor, metastases, carotid aneurysm of neck, paraganglioma of head and neck region, that includes glomus vagal, carotid body tumor, and glomus jugulare, and also caused by skull base osteomyelitis and fractures. Now coming to the symptoms of Villaret syndrome. Because of the lesion of 9th to 12th cranial nerves, and cervical sympathetic chain, and sometimes 7th cranial nerve also, causes Villaret syndrome. Symptom number 1, dysphagia or unable to swallow, especially solid food. It is due to the lesion of glossopharyngeal, the 9th cranial nerve, and vagus, the 10th cranial nerve, which make up the pharyngeal plexus, that supplies the muscles the pharynx and soft palate. Number 2, ageusia, or loss of taste, in the posterior third of tongue, caused by lesion of 9th cranial nerve. Number 3 is dysphonia, or unable to speak or slurred speech, and anesthesia of the larynx, caused by the lesion of recurrent laryngeal nerve of the 10th cranial nerve. Number 4 is paralysis of sternocleidomastoid and trapezius muscles, affected by the injury to accessory nerve, the 11th cranial nerve. Number 5, protruded tongue deviation, caused by lesion of hypoglossal, the 12th cranial nerve. Number 6 is ipsilateral facial muscle weakness, or palsy, due to the lower motor lesion of facial, the 7th cranial nerve, occasionally. These are the striking pictures, indicating the different symptoms of Villaret syndrome. Note, this is not the affected person's picture, mentioned in this case report MCQ. Apart from the symptoms mentioned above, the Villaret syndrome is also associated with Horner's syndrome, lesion of the upper cervical sympathetic trunk. Etiology for Horner's syndrome are stroke, tumor, neck trauma, cyst in spinal column, or syringomyelia, schwannoma, thoracic aorta aneurysm, chest surgery, damage of carotid artery or jugular vein in parapharyngeal space, skull base infection, or fractures, migraines, shoulder injury during delivery, and idiopathic. Coming to the symptoms of Horner's syndrome, are 1. Persistent small pupil, or miosis. Otherwise, notable difference in pupil size of two eyes, called as anisocoria. 2. Drooping of upper eyelid, or ptosis. 3. Sunken eye, or anophthalmos. 4. Little or no sweating on affected side is, otherwise known as anhidrosis. Dear medicos, I have one more question for you. What syndrome is brought on by a lesion of the 9th, 10th, 11th, and 12th cranial nerves, without Horner's syndrome symptoms? The answer is Kalicicard syndrome. This syndrome mimics the Villaret syndrome, but no sympathetic disturbances to the affected side. Like this. Some other syndromes also affects the lower cranial nerves. They are mentioned in this table. All these are caused by unilateral lesion, without sympathetic disturbances. Okay, let us circle back to the question. In this clinical MCQ, the right response is D, represents the 9th, 10th, 11th, and 12th cranial nerves. Dear aspirants, hope you find this information helpful for your medical career. Please add your valuable comments of this presentation. Thanks for watching. Meet you in one more valuable question. Good day, all.